Hi, everyone. I'm here today with Brett Winston. Brett is a preceptor at Springfield College. Um, so thank you, Brett, for joining us today and talking with me.
Of course, no problem.
Um, my first question I have for you is what is, or how long have you been a preceptor or clinical instructor for?
I guess I'm going on, let's see, probably 4 or 5 years, I believe, as an approved preceptor within a athletic training program.
Awesome. And what's your current position at Springfield?
So I kind of love that question because I do a little bit of everything at Springfield. I'm currently an instructor in the exercise science and sports studies department, specifically teaching athletic training related courses. I also serve as the assistant clinical education coordinator for the athletic training program. And then for 5 months of the year, I am a staff athletic trainer for the Springfield College wrestling team.
Awesome. That is really hitting all spectrums there.
They keep me busy.
How many students do you currently supervise? I understand you're not currently supervising any students because classes I don't believe have started for you, but how many students do you typically supervise?
So with my assistant clinical coordinator position, I kind of oversee all the students who are clinically active, doing site visits, et cetera. But in terms of being a preceptor and supervising students in their clinical experience directly, I usually average around 4 students a year within that 5-month time frame.
All right, wow. So you have to see everything, I guess.
Yeah, bird's eye view, I suppose.
Would you describe your position as a dream job, just a good fit, or just kind of something you're doing along the way?
You know, if you asked me this question 2, 3 years ago, I probably would have said no. It's just kind of something I'm doing along the way. My dreams were to work as an athletic trainer at a high level. Usually, I was thinking Division I football, which I got that opportunity in my first job. However, knew that I needed to go back and get my master's at some point. So my master's degree turned into a doctoral degree, which turned into teaching and clinical coordinating, which again, 2, 3 years ago, I think my career plans were a little different, but I really enjoy what I'm doing now. And I think my career path has shifted. And I would say that this is definitely a dream job for me, especially being in such a historic program that Springfield College is. So just really happy to be a part of it.
Awesome. So how would you assess your level of excitement for being a preceptor or a clinical coordinator?
I love it. I didn't think I would. You know, there's a lot of responsibility and administrative duties that come along with being a clinical coordinator in general. So I'm getting a taste of that as the assistant. But, you know, one thing, you know, within my busy schedule of all the duties I have, my favorite part of the day is being with the students, whether it be kind of visiting them at their clinical sites or supervising my own students with the wrestling program. So I definitely think precepting is typically the highlight of my day when I'm in season.
Awesome. And how many hours would you estimate that you spend each week working, and how many of those are spent being a preceptor in the clinical setting?
How many hours do I spend working? That's a loaded question. It's quite a few, and you know, athletic training is all about work-life balance right now, and I'm totally on board with that. But you know, like I said, I do have I kind of wear multiple hats currently, so I work a little bit more than I probably should, but I enjoy it. It's you know, they say you're hardly working if you're, you know, having fun with what you're doing. So really enjoying that. When I'm precepting directly, I usually am in the clinic from around 3 to 7 Monday through Friday, and then, you know, maybe one couple hours on the weekend. Again, that'll all change depending on, you know, whether we have a dual meet or if we're at a tournament, et cetera. But in terms of precepting, I'd say, I don't know, I'm not a mathematician, but probably somewhere around 20 to 30 hours a week.
Okay. And what are some of the perks and some of the positives of being in the positions that you're currently in?
For me, it's just exciting to see the first year students come in and get a real taste of what athletic training is. in my instructor role, I get to teach the incoming class. So I get like kind of that first chance to meet the first year students. And I actually we just graduated a class that I came in with. So I really enjoy seeing them progress from that first year to that fourth year. And then just hearing and seeing all the exciting things they're doing after they graduate. And in terms of the day-to-day stuff, I just love those light bulb moments when the students are in the clinic and like something just connects or clicks, whether it be something they struggled with in the classroom or in the lab setting, and then doing it on a real life patient, it kind of all comes together. So I really like to see that evolution of their learning as they go through the experience.
Yeah, and that class that just graduated happened to be my class, so Brett's one of us.
That's right. Happy to be the class. What is that, 2015, 16?
2016.
2016. All right.
What are some of the challenges that you face in being a preceptor?
So I think the challenges I face are similar to other preceptors. You know, we are first and foremost directly responsible for the healthcare of student athletes. And sometimes when you have students who want to learn, but and you want to give them experiences, it's not always the best time. So it's really a matter of balancing the high quality healthcare that you want to provide for your student athletes or your patients, while also providing a really strong clinical experience for the students. So it's kind of a tug of war at times, but I think that's part of the challenge and fun of being a preceptor, trying to find those educational moments that are as authentic as possible. So,
of course. And in what ways do you provide mentoring opportunities or provide mentoring to your athletic training students? Can you give us some examples?
Yeah, so I mean, first and foremost, regardless of what's happened in my day to that point, you know, 3 o'clock comes and it's my turn to go into the clinic. I just want to go in with as much energy as I can. I think just portraying a high energy and the passion that I have for athletic training is, you know, indirectly wearing off on the students. And I think they feel and they thrive on some of that energy that you bring. I know you can probably ask all athletic trainers, there's just some days where you just don't want to go to practice, or, you know, things have kind of become monotonous. And I really pride myself actually on kind of coming in with a fresh perspective each day. So that's really the main way I like to mentor. Also, you know, it's my job as a preceptor to provide socialization of the profession. So teaching them how to do an injury report, or teaching them how to communicate with a coach appropriately, or with their patients, teaching them bedside manner. So role modeling, providing opportunities for them to learn, that kind of thing.
And anyone who's seen Brett in the clinic knows that he definitely brings a lot of energy to the clinic. So that's spoken very well. Yeah. Do you feel like you're a good mentor to the athletic training students, and why or why not?
Yeah, I do. I really do. And I don't think it's by what I do. I honestly think it's how I go about providing healthcare. You know, I try to provide the highest quality of healthcare for my student athletes, while also giving my students that opportunity to learn. And again, just coming in with the passion that I have for the profession. You know, I'm certainly not one that's shy or reserved. I'm pretty outgoing in that way, and I'm not afraid to show my passion for the profession. Sometimes that looks like excitement, sometimes that looks like frustration, sometimes, you know, it's a mix of emotion. And I think we go through those as athletic trainers, the ups and downs, the injuries, the bad days with coach, the good days with coach. So just showing the students that is just so vital.
And what excites you the most about the athletic training profession?
You know, I think we're really progressive. We were so rooted for so long, and I think the profession is really starting to kind of branch off and really show some fruit from those roots that we've planted so many years ago. And you know, we're taking strides in legislation. We're pushing our practice acts to the limits. We're making positive change for the benefit of the consumer, for the patients that we're serving. So I really love how progressive we are. I think our leadership is strong, and just really looking forward to this next generation. You know, we always talk about the good old boys of athletic training, but it's changing. You know, there's a lot of strong female leaders in the profession right now, and I'm eager to see my cohort as a young professional really kind of taking charge and putting ourselves out there to continue what they've started.
For sure. And you talked a lot about how you bring excitement and energy into the clinic. In what ways, can you give us some examples of how you go about doing that a little bit?
Yeah,
you kind of portray it.
Yeah, I think one of the biggest things is, you know, these students, you know, they come into the clinic for 4 or 5 hours after being in class all day. And, you know, sometimes you just got to have a laid back atmosphere. There's obviously times where you need to be really focused and athletic training driven. But, you know, I don't sit there and drill my students with athletic training information for 4 to 5 hours. We talk about life. We talk about what's going on in the college. We talk about future aspirations. So I think it makes the students feel more comfortable in the setting, and I think being approachable about different conversations like that is also really key.
Okay. And then the last question is, did you have any, or would you have any advice for young preceptors or new preceptors like myself?
Yeah, we just went through our preceptor training here, and we've got some folks that have come in that are new to us. And what I keep telling them is make sure you think out loud. And they kind of turn their head and look at me like, you got 12 heads. But what I mean by that, you know, whether you've been practicing for a year, whether you've been practicing for 20 years, you know, you come somewhere new, your first job, you know, in your mind is to establish yourself as a clinician to your superiors, earn the trust of your patients or your student athletes. And a lot of times the education piece for the student is the last thing to kind of pick up. So I think if you start by thinking out loud, then the students hear your thought process. They see you role modeling the profession and what we do. But again, thinking out loud kind of brings the student into the picture and allows them to kind of not only see what you're doing, but kind of an inside view of your brain. And because again, the hardest thing for a new preceptor is to balance, like I talked about, providing high quality healthcare and establishing yourself in a new setting while also making sure that the students get a good clinical experience. So if I had to sum it up, it would be think out loud.
That is a very interesting advice. I never would have expected that, but thank you. I think that is very insightful. So thank you, Brett, for taking the time to talk with me. I really appreciate it. And thanks everybody for